డాక్టర్ బిఆర్ అంబేద్కర్ సార్వత్రిక విశ్వవిద్యాలయం విద్యార్థులకు స్వాగతం. ఈ ప్రసారంలో
We will now discuss about common childhood diseases in children, their prevention and immunization. Childhood is a period when children are prone to get several diseases. Most of these diseases are communicable. A communicable disease is one that is transmitted from person to person. These diseases are caused basically by microorganisms, mainly viruses and bacteria. We will go through the various viral diseases and the bacterial diseases that are found commonly in children. The viral diseases we will go through is measles, common cold, German measles, whooping cough, chickenpox, infective hepatitis, poliomyelitis and mumps. The bacterial diseases are enteric fever, diphtheria, diarrhea and tetanus. We will go through basically the signs and symptoms and care of each of these viral diseases. Measles. Now measles is a common disease found in toddlers and preschool children. It is more common in children belonging to the underprivileged classes and who are undernourished. This is transmitted through sneezing, coughing and infected toys. Measles starts off with a cold, a cough, sneezing and a sore throat. There is fever which is very high. It may go up to about 104 to 105 degrees Fahrenheit. There is loss of appetite and headache. The rash appears on the 4th day of the fever, and the rash first appears behind the ears, then proceeds to the face and the neck and the different parts of the body. The rash is finely distributed and it may become blotchy later on. Gradually, there will be a peeling of the superficial skin and then the rash comes down. It is necessary to see that the temperature is kept low because there may be a danger of febrile convulsions occurring in the child. A few of the complications are laryngitis, blindness due to conjunctivitis, and otitis media, or in other words, middle ear infection. The main problem with measles is pneumonia, which gets precipitated especially in children who are undernourished. The next disease we will go through is common cold. From the word itself, it implies that it is very common. Common cold comes to children, infants, it comes to adults also. Normally it lasts for about 3 days to more than 10 days. And it can come to any age. This is transmitted through coughing, sneezing, then secretions of the nose and the mouth. The signs and symptoms of common cold are a runny nose, you have stuffiness in the nose, the person can have a headache, and if a cold is given relief, then by keeping the child warm and comfortable, the cold will pass off. If it is a neglected cold, the child can get middle ear infection, bronchitis and pneumonia also if it is a neglected cold. Now the third disease is German measles. Now German measles is similar to measles. However, the signs and symptoms of German measles are not that severe as what is found in measles. Now this is common in children and adolescents. This is transmitted through coughing, sneezing and infected toys. The signs and symptoms of measles, as I told you, is mild as compared to measles. The child has a mild fever, he has sore throat, he has a runny nose, he has rash which starts off first on the face and then proceeds to the other parts of the body. Now, if a child gets German measles, there is not much of a problem because the disease passes off without many complications. However, if a pregnant woman gets German measles during the first trimester of her pregnancy, the fetus will be affected very badly and the child newborn may be born with multiple deformities, especially mental retardation, cataracts, and could be the hearing also will be affected. Therefore, it is essential that pregnant women protect themselves from this disease. The next disease is whooping cough. Now, whooping cough is common in toddlers and it is very dangerous in infants. Child in whooping cough starts off with a cold, a bad cough, especially the cough is spasmodic, or in other words, it comes in a fit or it comes in spasms. The child has fever, and because the cough comes in spasms, it can ultimately cause vomiting in the child. Therefore, feeding becomes a problem. And it is necessary here, especially in whooping cough, to see that small feeds which are devoid of roughage, which is bland, soft, nutritious, should be given to the child during the time when he doesn't have the fit, that is in between the cough. You can give these feeds to the child so that he gets sufficient nourishment. Then the complications in whooping cough is middle ear infection and sometimes it can also cause a squint eye. The next disease is chickenpox. Chickenpox we commonly see in children. It is very common in children. Sometimes adults also can get it if they don't get it in childhood. Now, in chickenpox, the disease is transmitted through sneezing, through coughing, through contact and also through infected articles that are used by the patient. The chickenpox starts off with a fever. The child has loss of appetite. He gets rash and this rash is a little distributed, that is, it is not in clusters but it is distributed especially on the face and later on it proceeds to the other parts of the body. Initially the rash is in the form of flat red spots which later get filled with a clear fluid, and this fluid changes to pus and at this time it is known as a pustule. Gradually the pustules dry up, the scab formation takes place and then the scabs drop off. Initially there may be scars, but gradually as time goes by the scars will disappear. Normally chickenpox doesn't have any complications. However, because it causes a lot of itchy sensation in children, if it is not supervised, a child can scratch very badly and this can cause secondary infection of the pustules, which may leave permanent scars. The next disease is infective hepatitis, or what is commonly known as jaundice. This is more common in older children. Now, this is transmitted through infected water, food, and infected stools. Therefore, we have to be careful while we are handling the patient, see that proper hygienic conditions are maintained. The child starts off with a fever, a loss of appetite. Sometimes there could be nausea and vomiting too. There may be a sudden dislike to fatty food and to milk. The yellow pigmentation due to the bilirubin pigment is caused, and the skin and the conjunctiva of the eyes become yellow in color. It may be noticed that the urine becomes dark in color, whereas the stools become pale colored. A fat restricted diet should be given to the child. Though the child requires a lot of energy, the calories should be got mainly from the carbohydrates and not from fat. Therefore, we may have seen many patients being given sugarcane juice because it is loaded with calories. The next disease is poliomyelitis. Now, poliomyelitis is transmitted through virus excreted in the stools and also through contact. Now, this is a dreadful disease because it causes permanent crippling of the child. In poliomyelitis, the child starts off with a headache, there could be nausea, body pain, and stiffness of the back and the neck region. Gradually, paralysis of one limb or both the limbs occurs, and this paralysis is accompanied by wasting of the muscles. Physiotherapy plays a very important role in the treatment of poliomyelitis if the child is brought in the initial stages. Care should be taken to disinfect the stools and all discharges from the nose and the throat before disposal. And it is important now that all parents take their children for the pulse polio program, because this is the only way that poliomyelitis can be eradicated. The next disease is mumps. Now, mumps is common in children and it is a highly infectious disease. If one child gets it in a classroom, you may find that all the children will be down with mumps. Now, mumps starts off with fever. The child has a sore throat, which makes swallowing very difficult, and therefore he may not be able to eat. There is pain and swelling of the parotid gland, which is situated under the jaw. Now, the complications with mumps are not very severe in the child. Normally, it is uncomfortable for the child to have that swelling, but gradually it goes off. Within 2 weeks' time, the swelling and all may go. However, if a child beyond the puberty age gets mumps, then it affects the reproductive organs and may cause sterility. It affects the ovaries in the female and the testis in the male. Now we will go on to the different bacterial diseases. Enteric fever is one, which is commonly known as typhoid. This affects young children, adolescents and adults. Now, enteric fever actually includes 3 closely related diseases, that is typhoid, paratyphoid A and paratyphoid B, which is collectively known as typhoid. Now, this is transmitted through food and water. Now, enteric fever starts off with high fever, which stays for not less than 3 weeks. The child has a headache, loss of appetite, he has tiredness, there could be vomiting and diarrhea too. Abdominal pain may also develop, and this may be mainly due to the intestinal ulcers that can come, which can lead to a hemorrhage or perforation of the intestines. This is an emergency condition and definitely requires surgical intervention. It is necessary to give the child a bland, soft, nutritious, protein and vitamin C rich diet so that healing can take place fast. The next disease is diphtheria. Now, diphtheria is very fatal and can occur in children and adults. It is transmitted through coughing, through sneezing, talking, and contaminated articles used by the patient. It starts off with fever, sore throat, headache. There can be loss of appetite and vomiting too. It attacks three major areas of the body. One is the throat. Now, when it affects the throat, white patches will be seen in the throat. The nasal passage also can be affected, and it can lead to discharge from the nasal passage and sometimes bleeding also. Now, the larynx, when the larynx is affected, there is severe cough and there is difficulty in breathing. Because of this difficulty in breathing, a surgery known as tracheostomy may have to be performed, that is, to make a hole in the trachea to enable the child to breathe. The complications in diphtheria are very severe. It can cause paralysis of the palate, the neck, the trunk, the diaphragm, and the limbs. Ultimately, the toxin attacks the heart muscle and can lead to cardiac failure. The next disease is diarrhea. Now, diarrhea is very commonly seen. It can be seen in infants, in preschool children, and also in adults too. Now, this is basically transmitted through contaminated milk, especially in children, then with contaminated water, contaminated food, and unhygienic conditions. Now, in diarrhea, frequent watery stools are seen, and sometimes it can be accompanied with vomiting also. Because of the constant diarrhea and vomiting, the body fluids can be depleted and it can lead to dehydration. Therefore, constant rehydration of the body needs to be done. Now, how do you identify dehydration? In dehydration, you find that there is reduced elasticity of the skin, especially if you pull the superficial skin on the abdomen, you will find that the skin stays up for a few seconds before it collapses down. Now, this indicates reduced elasticity of the skin. Then there is excessive thirst, there is parched lips. You find that their child will get sunken eyes. Then there is a depressed anterior fontanelle. Then there is decreased urine output and sometimes decreased tears also. Now, for this condition, oral rehydration solution, that is ORS, should be given to the child. You can get this electrolyte powder also from the market. You can dissolve it in water and give it to the child. The home remedy is boiling and cooling water and adding about 2 teaspoons of sugar and a pinch of salt. That also can be given in emergency before you are able to give the oral rehydration solution. Now, the complications in diarrhea are quite fatal, especially if the depletion of fluids goes beyond 10%. Now, the next disease is tetanus. Now, tetanus is very, very fatal, either in children or in adults. Now, this bacteria enters the body through any ruptured skin, that is, through cuts and wounds. The bacteria can enter the body. Now, this bacteria attacks the motor nerve cells. So, we find that a child who is having tetanus starts off with fever, he has body pain, he has a lockjaw. Lockjaw means it is like a lock that is put to the jaw. The jaw is not able to move, or there is rigidity of the lower jaw. Then there is severe convulsions can occur, and the body can take the shape of a bow. That means the whole body goes into a fit or convulsions. Then it is required to keep the child in a dark environment which is totally free from any type of stimulus. That means even light or sound or movement, these things can make the child go into a convulsion. It is very fatal and the death rate in tetanus is very, very high. Now we will just see whether we are able to prevent these diseases in children. And it is good that some of these diseases can be prevented. And these diseases can be prevented by giving immunizations to the child. Now, immunization is a process of giving vaccines in order to protect the child from specific diseases. So, this is the process of immunization. Now, a few points that need to be kept in mind, which could be very often overlooked, is all children need to be immunized. Some people have the notion that only a sick child or an unhealthy child needs to be immunized. No. Whether a child is healthy or not, all children need to be immunized. We'll just go through the schedule so that we know which disease is prevented and at what age you need to give the disease, you need to give the vaccine, and how many doses you need to give. Now, at birth, you need to give BCG, which is actually the short form of Bacillus calmette-guerin. Now, this BCG vaccine is given to protect the child from tuberculosis. Then at birth, even OPV is given, that is oral polio vaccine. Now, oral polio vaccine is given, that is the 0 dose is given at birth, then to protect the child from poliomyelitis. Then hepatitis B, first dose is given to protect the child from hepatitis. Now, at the age of 6 weeks, DPT first dose, that is a vaccine which is known as triple vaccine. It contains the vaccine for diphtheria, pertussis or whooping cough and tetanus. These three are given in one injection. So, the first dose of DPT and oral polio vaccine, that is from the word itself we know that it is given in the mouth. Oral polio vaccine is given in the form of drops and it is given for protecting the child against poliomyelitis. Then you also give hepatitis B second dose against hepatitis. These are given at the age of 6 weeks. Then at the age of 10 weeks, DPT second dose and OPV second dose is also given. At the age of 14 weeks, we give the third dose of DPT and OPV. Now, this information is very valuable for teachers, because if teachers know about the communicable diseases, the identification of communicable diseases based on the signs and symptoms, and the protection of the child through vaccines, it will be very beneficial for her, especially in the classroom. It will help her to protect the other children also in case she needs to isolate this child, and she can take the necessary action and do the needful.
మా కార్యక్రమాలపై మీ సూచనలు సలహాలు ఆహ్వానిస్తున్నాం. మీ సూచనలు సలహాలు మాకు తెలియజేయవలసిన చిరునామా: డైరెక్టర్, ఆడియో విజువల్ ప్రొడక్షన్ అండ్ రీసెర్చ్ సెంటర్, డాక్టర్ బిఆర్ అంబేద్కర్ ఓపెన్ యూనివర్సిటీ, ప్రొఫెసర్ జి రామరెడ్డి మార్గ్, రోడ్ నంబర్ 46, జూబ్లీ హిల్స్, హైదరాబాద్ 500033.